Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates.
Though this pandemic may have exposed the city's health infrastructure, but it has also given us real-time heroes. Right now we are here in Sion Hospital with two such heroes, two such frontliners. Dr. Alok Sharma, the head of department of neurology in Sion Hospital, and Dr. Kshitija Mahajan, the anaesthetist. Dr. Alok and his team operated a 1.5-month-old baby for brain hemorrhage. The baby was a COVID-19 patient. The surgery was performed in the middle of the night when Dr. Alok was informed about the deteriorating health condition of the baby. At one point, when the COVID-19 protective gear did not allow the anesthetist to get close enough to insert a pipe through the baby's mouth into his airway, Kshitija Mahajan just removed the headgear without any hesitation and went ahead with the procedure. This was a brave move from Kshitija Mahajan, who risked her life to save the baby. Knowing that she would be exposed to the virus, she did not even hesitate or think twice before doing so. सर कुछ दिन पहले आपने यहाँ पे एक सर्जरी की थी एक 1.5 month-old child की, suffering from brain hemorrhage, and that was a really heroic thing to do. How the way you saved his life, what had happened? Can you brief us about the surgery?
So this was a 1.5-month baby who had been actually born premature at 8 months. The baby was just 2.5 kg, and what happened was that this baby developed cough, cold, and so the parents brought him to our hospital, and when they tested, they found him to be COVID positive. So his COVID treatment was started. But then what happened was that the child started deteriorating neurologically, started becoming unconscious, started becoming weak. And so then we did a CT scan. What we found was that there was a large hematoma on the left side of the brain. So, and as the child was deteriorating, we had to operate the child late in the night. So at about 2 o'clock, our whole team assembled. Apart from me and my other colleagues, there was Dr. Kshitija Mahajan, who headed the anesthesia team. And then we also had the pediatricians who were there with us. So we started the surgery around 3 a.m. And what we did is we made a hole in the skull and we evacuated the blood clot. So that is what happened.
Doctor, what were the challenges you faced during that operation?
So the real challenge was that this was a 2.5 kilo small baby. Okay. Now the challenges of this are many. Now for the purpose of surgery, the real challenge is that of anesthesia. So Dr. Kshitija Mahajan here, who's the assistant professor in the anesthesia department, had a very, very difficult job of actually trying to put a tube in to be able to have the child to breathe before anesthesia. And doing this in a small baby who is COVID positive is especially challenging, because if there are any secretions, when this happens, the anesthetist is directly exposed. But in that process, when we are doing it, what happened is there was some difficulty. And because it's a very small baby, Dr. Kshitija had two choices. Either she would continue to struggle or she could remove her mask. So what she did was something very brave and courageous. She actually removed her protection, the face shield, to get proper vision to be able to put the tube inside. And I think that amazing act of courage, where she put the child, the patient's safety before her own safety, was the real challenge of this whole procedure. And she successfully put it in, but in that process, some of the secretions, etc., did come onto her face, but she did not bother about this. She ensured that the child got safe anesthesia, and because of that safe anesthesia, we were able to successfully do the operation. So we did the burr hole, we removed the entire blood clot, and the operation was very successful. And most important, after the operation, the child did very well.
Kshitija, this heroic act which you did, just tell me one thing, what was going on in your mind? What were you thinking actually that time?
Well, I'm really proud to be an anaesthetist. At that split second, it's a reflex impulse which we have given, and God has chosen us to do that. And I literally did what was expected of me. I myself, being a mom to twins, I really value and nurture human race. And for that kid, it was no second thought, and I did what it was justified at that hour, without thinking of me and putting myself at risk and my kids and my family back home.
What is your family's reaction after this?
It's a mixed reaction, definitely. They were indeed, my husband is...
Husband also works in a COVID ward in Sion Hospital.
Yeah, he's Dr. Neeraj Mahajan, and he's COVID in charge, nodal officer at Sion Hospital, obstetric unit. He was really proud, but then it was a mixed reaction. I said, my kid, I was quarantined for 14 days, which itself, staying away from family with twins and boys more so. So it was a difficult family affair to keep.
This was a very difficult case, and that too in times of COVID, this pandemic. I want to ask you, doctor, how is the situation different right now from what it used to be earlier? Like, that child was a COVID child. There was a risk of infection also. So how did you handle that situation?
So, prior to March, prior to the Corona era, I call it BC, before Corona, when we saw patients, all we were thinking of is patients. Okay, we had to, there was no other thought in our mind. But now we also have to think of the protection of not just us, but the entire staff. There's the nursing staff, there's the housekeeping, there's everybody else. So whilst we are treating patients, we have to look after them and look after our own staff. So it's also important in such times, I believe, to show leadership. So one of the reasons why I was there was because when senior people are there up front, it's a morale boosting thing for the junior people. They see the seniors up front, they see the seniors taking risks, and then they feel, yes, we can do it too. So it's very important that in this, and I actually consider this to be wartime. I actually tell all our students, these are not normal times. Don't get judgmental about we have to do this or we have to do that based on how life was before March. This is wartime. In wartime, you have to do things differently. You have to do what is needed and required. You have to do what the situation demands. And here they can't be, I like this, I don't like this, I want to do this. You have to do what has to be done.
So tell me one thing, doctor. This operation which you did, it was definitely a challenging thing. But apart from it, what was tell me that one risk factor जो होता है ना कि the doctors take chance कि this might work. What was that moment?
So, no, there were actually many such moments. So it really started off with the anesthesia. And I'd like to repeat the courage that Dr. Kshitija showed. And I just want to say that, you're very amazing. I was there when you were doing this, and I really admire your courage and the fact that you put the patient's life before your own safety. It is an act of courage. And I think your act of courage should be an inspiration to an entire generation, because I know out there a lot of anesthetists are today worried, when it comes, because now suddenly because you see, let me explain what happens in anesthesia. You have to put a tube in the mouth. You're directly exposed to the secretions of the patients. So there are few, the anesthetists, dentists, ENT surgeons. These are people who are directly faced to, this area of the mouth. So there is fear, and anesthetists have to do surgery for everyone. So I think this is an inspirational call to all anesthetists, all right? That that their job is very, very important. It is life-saving, right? Because unless they do what they do, I cannot operate. I would not have been able to operate if Dr. Kshitija had not given the anesthesia. I think this is an inspiring story to an entire younger generation of people who have fear in their mind. And we need to get rid of that fear. We have to understand that in wartime, soldiers have to do what they have to do, and we are the soldiers of this war.
In your career, you must have come across many such challenging cases. How was this case different from your other cases?
So this was the first COVID positive patient I treated. Okay, I mean, I've done thousands of surgeries, but you've never operated a COVID positive patient. Now, it's not the surgery that's difficult. It's the entire environment in which it is done. All right. So, and of course, here it was this very small baby, 2.5 kilograms. You know what? 2.5 kilograms is nothing. Then Apart from that, the baby had many other medical problems. For example, the child had what are called coagulation problems, okay, which meant that, see, normally if you have a cut, the body heals itself. So here the coagulation was deranged. Earlier to that, the hemoglobin was low. The baby was so small. He had this massive brain hemorrhage. There was pressure inside the brain. So the small size of the baby, the multiple problems of a brain hemorrhage, coagulation profile, everything else, the challenge of anesthesia, the time at which we are doing it, this is middle of the night at 3 o'clock, So that poses a different challenge. And the whole environment, because when we are there in an operation theatre, knowing there is a COVID positive patient, because you have to understand when you are doing this, the whole, the air all around is likely to be full of viruses. Then we have to wear face shields. Now these face shields get fogged. Now that's another very challenging thing, because as we are operating, because of our breath, there's a fogging that happens. And then you can't see clearly. So we are used to, when we operate, see everything very clearly. And now suddenly you have to operate through a fog field. So it wasn't one. There were so many things all put together that made this a very, very different and challenging experience.
Sir, there are a lot of, like this pandemic has, we can say, exposed a lot of government hospital, the medical infrastructure. Okay, आपका क्या कहना है इस पे? What do you have to say?
See, it's very unfortunate that our public hospitals come up in the news for the wrong reasons. What most people don't realize is that when it comes to crisis and disaster, we are the ones to help the general public. For example, when we had the serial train bomb blasts, we had 50 patients coming to Sion Hospital at one time. When all the other bomb blasts that have happened, all the other natural and artificial disasters, the bulk of the patients come to our hospital, the LTMG hospital, because north of us, there's no major, all the big hospitals, KM, Nair, JJ are all south of us. So we cater to the entire half of the city. So when it comes to disasters, it is the public hospitals that are actually in the forefront. They are completely overwhelmed. We don't have beds. Yes, we have difficult situations. We have shortage of beds. We have shortage of staff. But most important, we never say no to any patient. Any patient can walk in and gets treated entirely free of cost. Also, this particular surgery that we did, where we had neurosurgeons, anesthetists, pediatricians, an entire team in the middle of the night, this kind of teamwork, it's possible, and of course it happens in private hospitals, but in government hospitals, municipal hospitals, this happens much easier and much faster. So I think in these times, our hospitals, despite the limitations, despite the infrastructure limitation, despite the staff limitations, have borne up to the situation and have handled everything that they possibly can. So yes, there have been some negative stories, but there are a whole lot of positive stories. A whole lot of, hundreds of patients have been saved. But most important, the people who come here have nowhere else to go. They cannot afford the private hospitals. They have nowhere else to go. So we are looking after those people who have nowhere else to go. So I think it is in these disasters that the importance, the need, and the role of public hospitals in the healthcare system gets highlighted.
So that was Dr. Kshitija and Dr. Alok from Sion Hospital. Dr. Alok was speaking to us before the interview, and he says that there comes one moment in your life which decides if you will be proud of yourself for the rest of your life or you'll be ashamed of yourself. So that, I guess, that was one moment which actually has left not only the doctors or the family, but even the entire nation proud of what these frontline workers are doing for us, for our safety. They are risking their life and going out of the way to ensure that we remain safe, we remain healthy. With Shiva Devnath, this is Nazia Sayed for Mojo News, Mumbai.